Good afternoon. Am I audible to all of you?
Hi, Dr. Maryam, you are audible. Just give us 2 minutes so that we can go live on Facebook and then you can start. Thank you.
Okay, sure. Thank you so much.
Yes, ma'am, we can hear you.
Okay, that's perfect. Thank you so much.
Hi, Dr. Maryam, we can start now. Thank you.
Thank you so much. So good afternoon, everyone. Today we are having our live webinar, and the topic of webinar is understanding OET scoring, understanding the assessment criteria, sorry. So I'm Dr. Maryam Zulfiqar, Head of Department for OET at MedExam Expert, and I'm working as Senior House Officer in Health Service Executive in Republic of Ireland. So today we got a time to talk on this topic. So I hope by the end of the webinar, you won't be having any of the query regarding assessment criteria for this exam. So let's start with our webinar today. So before talking about assessment criteria, I would like to tell you about OET overview. And you all must be knowing this thing, that what is OET? So OET is Occupational English Test, which accurately reflects a candidate's ability to communicate in English-speaking healthcare workplace.
Yes.
Everybody, please switch off your microphones. So OET reports a scale score from 0 to 500, which is equivalent to letter grade from A to E for each individual subtest. OET exam is accepted by healthcare professionals who are looking to work or study in the healthcare sector in Australia, Canada, Ireland, Maldives, Malta, New Zealand, Philippines, Qatar, Singapore, Spain, Ukraine, United Kingdom, United Arab Emirates, and United States of America. So I'm giving you the overview for few of the countries which are mentioned over here. So these countries do accept your OET exam. If you are a healthcare professional and you are you're thinking of starting your career abroad in these countries, you are good to go for booking your OET exam. So we are going to start with OET listening scoring criteria, because we know that listening is the first subtest of the OET exam. So the total marks for the listening is 42. Use the calculator, find out how many correct answers you would need to get a grade B in reading and listening modules. As per the OET website, one typically needs 30 marks from 42 questions to get grade B. If you are acquiring 30 marks, you can get grade B in listening module. Okay. So there is some of the marks distribution according to the parts of listening module. We know that there are 3 parts, part A, part B, and part C. So the OET listening papers are marked by a combination of assessors and computers. For part A, which is basically a blank, filling the blanks answers. So for part A, which is the task that requires test taker to fill in the set of notes about a consultation between doctor and a patient, assessor marks the answer, and the other part of the OET listening paper, part B and part C, are computer scanned. So for part A, you are being assessed by assessors, examiners, and for part B and part C, you are being assessed by computer checking. So Part B and Part C are computer scanned as they are multiple choice tasks. Part B includes 6 short conversations or monologues that include different healthcare professionals, such as nurses, doctors, occupational therapists, and ward leaders. And Part C features 2 longer presentations or interviews on journal healthcare topics. So you have to be very familiar with all the stuff that what you are going to do, that what is the chances of monologues or dialogues coming in the exam. So you must be familiar with the pattern of the listening module. Part A of the OET listening paper is double marked, meaning 2 assessors check the answer. Both assessors use a very detailed marking guide that clearly shows which answer are to receive marks. The guide is to help assessors determine if you, the test taker, have provided enough of the correct answer to receive a mark. So for Part A, there are 2 assessors basically which double check your paper. Because some of the time there are 2 or 3 answers that can be fitted in your blank. So if anybody has written down 2 or 3 options by putting the slash in between all the words, then definitely one can receive the marks for that. Assessors also have to make sure you have not included any conflicting information to your answer that makes your meaning unclear. This means that you should try to keep your answer short so that you don't include extra information that may contradict with the correct part of your answer. So that's very amazing thing to know. The thing is, students do ask that if we can write a full line in the blank. So please don't do this. If you're going to do this, then definitely it may change the meaning of your answer. I would say if you are confused that if this is the answer or if this is the answer, like if there are most similar words, you can write the word only and you can put the slash and then you can write another similar word which you think can be adjusted here. It is important to keep in mind that Part A does not require you to paraphrase what you hear in the audio. You must complete the notes with the same words you hear on the recording, such as name and description of medical condition, the name of a medication, or a type of laboratory test. So there are some of the tricks to get 30 out of 42 in the listening part. Try to correct all 24 in Part A and all 6 in Part B, which is not a difficult task to do. To be very, very honest, I would say to get 24 in Part A and to get 6 in Part B, it is very much easy. You will be having margin of doing mistakes in Part C, which actually is difficult and challenging. So the thing is, once we know that Part C is very much difficult, so why we are trying to get good score in C other than we are not trying to get all the correct in Part A and Part B? So think about it. If you are having 12 questions in Part C and you are not well prepared for that, still there is a chance that you can still get 3 or 4 out of 12 correct in Part C. But if you are putting all your efforts on Part A and Part B, then definitely you are having 30 in your hand. So you are having 30 plus in that case. But what students do, they get bothered by Part C and they used to put all the efforts on Part C, which is actually difficult. And they don't do great. They don't perform well in Part A and Part B as well. So if you think that you are struggling with Part C, I would say prepare your Part A and Part B very, very best. If you are going to do this, then definitely you are easy to score above 30 in your listening module. For this, try at least 30 to 35 tests for practice before real exam. Then your score in OET listening will reach 30 plus in the real exam. If you are struggling regarding this module, this is a way that you can practice at least 30 to 35 listening exercises so that you would be able to score 30 plus in your real exam. So now we are going to talk about reading scoring criteria and the tricks as well. So again, the same thing applies for the reading. There is a total of 42 marks available in reading subtest. Part A accounts for 20 marks, Part B for 6, and Part C for 16 marks. So this is basically the marks distribution in both the listening and the reading module. If you are a beginner, if you are a new test taker, I would say you have to be familiar with the marks distribution so that it would be easy for you to set your goal and set your target. Here are 5 ways to read faster and tips for approaching OET reading Part A. You have to begin with skimming. Skimming means you have to go through each and every word, okay? This is basically the overview of the paragraph or the passage given. You have to go through, like, it should be very fast, but it should be a fast reading type of thing, so you are not missing any of the thing. This is called skimming. Highlighting the keywords. You are allowed to mark your words with the help of pencil, but the thing is, then you have to erase it when you are submitting back your question booklets to the examiners, invigilators, sorry. So the thing is, you can highlight keywords because most of the time, like 85 to 90% of the time, whenever you are highlighting keywords, your answer would be above and below that line. I'm talking about Part B in that scenario. For Part A, the most important thing is time management because you have to complete 15 questions. You have to complete 20 questions in 15 minutes. So that's actually a game of time management. So you have to be very, very quick and fast in that because Part A is very much easy. So it is easy, very much easy for anyone to get grade B in reading if they are performing well in Part A and Part B. So highlighting keywords, retain exactly what you read. Be prepared to read a question, skip the options. What you have to do is just read the question first. Don't go for the options. You have to go back to the passage and then read the options. You would be able to find your answer very well. You would be able, like, if you are going to do read question, then options, then passage, there are only 30 to 40% chance you can find the answer. But if you are reading a question, you are going to passage, and then you are reading your options, then it is much higher chances you can easily find the answer. Provide yourself with plenty of practice. Try to correct all 20 in Part A and all 6 in Part B, which is not a difficult task to do. You will be having margin of doing mistakes in Part C, which actually is difficult and challenging. For this, try at least 30 to 35 tests for practice before real exam. Then you score good in OET listening, and it will be around 30 plus out of 42. So the same formula applied for the listening and the reading module. You have to put all your effort on Part A and Part B for reaching grade B in both of the modules. So this is actually the trick. Now we are going to talk about writing scoring criteria. So how many points you need to score grade B in OET letter writing? Total marks you can get is 38 points. You need to score the following for grade B. And what are the following factors in which you have to perform well? Okay, so we know that now the total point is 38 and purpose is having 3 marks. And to be very, very honest, a lot of aspirants don't even know what is the purpose of the letter is. If there is any course student here, I'm not sure if our course students are here in the webinar today, you might be able to answer that what is the purpose of the OET letter writing in, and or he or she may be knowing that how much significant is this. Because if your letter is not having a definite purpose, examiners won't even bother to read the rest of your letter. Anyways, the other thing is content, which is carrying 7 marks. Clarity is again carrying 7 marks. Genre and style occupies 7 marks. Organization and layout, 7 marks. And the language, 7 marks. So If you are scoring 27 out of 38, you can get grade B, which means 350 out of total 500. But what do these factors mean? What is purpose? What is content? What is genre and style? What is organization and layout? So aspirant who is just a new test taker, who is in the beginning of taking OET exam, doesn't even know what these factors are. So that's why that's the biggest reason for failure in OET writing module, because it is, I would say, it is easy to pass reading and listening module just by solving the exercises. But for writing module, I would say this is the major cause of failure for a lot of aspirants, because they don't even know that what these terms mean. Okay. So your letter must be containing all of these terms, which means purpose, content, clarity, genre and style. Your organization would be good. You are using the simple and clear language. If you are scoring 27, then definitely you are achieving grade B. But if any of this is missing, especially purpose of the letter, you are standing nowhere, and definitely it is not grade B. So writing assessment criteria, now I'm going to explain each and every factor. The purpose should be easily and immediately identifiable for the reader. So there is no search for it. Whenever you are going for assessment, there should be easily and identifiable purpose in your letter. So examiner is not thinking that where the purpose of this letter is. If there is impression like this, then definitely you are not getting grade B. The content of the OET letter writing is the information included. Okay, so you have to search for the content. It is you who have to decide which information should be written, which information you are going to deliver today. Conciseness and clarity, no irrelevant information included. We know that OET exam does require that there should be no irrelevant information in your exam. Information is summarized effectively and presented clearly. Genre and style means appropriateness of your letter based on your reader. Your register and tone should be professional and appropriate to the document's purpose and audience. So you have to present appropriateness in your letter. If you are going to do it, you are getting grade B, very sure. Organization and layout, key information is highlighted and subsections are well organized such that reader can retrieve information quickly and easily. And for the language, spelling, punctuations, vocabulary, grammar, sentence structure are accurate and do not interfere with the meaning. So I would say, please use simple and clear English. This is your language test exam. In other language tests, there is a demand for using fancy English, but in OET letter writing, there is no such demand. So I would say, please use simple and clear English. And then there comes speaking module. So OET speaking, I'm going to let you know about the overview of this, what happens in the OET speaking. This is another subtest in which failure ratio is much more than other ones, because the thing is, for reading and listening, aspirants do prepare themselves. But for writing and speaking, they can prepare, but they can't practice with themselves. This is the basic reason. So what happens in OET speaking? You complete 2 role plays with the interlocutor. You play the role of profession. Whatever your profession is, we know that there are 12 professions who can take OET exam. For example, nurse, doctor, physiotherapist, speech language therapist, pharmacist, whoever you are. And the interlocutor plays the role of your patient or their carer. You are given all the information you need on a role play card, and you have 3 minutes per role play to prepare. No, not only in this is a more comfortable scenario for you as a healthcare worker, but it also means that as you are preparing for the test, you are improving the language and clinical skill for your future workplace. And how you are scored in OET speaking. Your role plays are recorded and assessed by at least 2 trained OET assessors. The rate your speaking performance using linguistic and clinical communication criteria. So you are being assessed on both criteria, which is linguistic, your language, and your clinical communication. So your medical knowledge is being tested basically in your speaking module. In this blog, we outline each criterion so you can see at a glance how your speaking skills are measured. So now I'm going to talk about linguistic criteria first, and after that we will be talking about your clinical skills criteria. So linguistics criteria total 6 marks for each factor: intelligibility, fluency, appropriateness of language, resources of grammar and expression. So the thing is, you have to be very efficient in all of these. Intelligibility means being able to speak clearly so others can understand you. You need to pronounce words and sounds clearly. Use the right tone of the voice and use stress and rhythm in your sentences. Let me tell you very honestly, if you are confident enough to talk about the thing, even you are not having enough of the knowledge about that thing, but you are talking confidently, you are good to go in OET speaking. They only test your confidence, that how much confident you are. So your voice should be in the right tone. There should be clear pronunciation of words. And you have to be very, very confident in what you are saying, even though you are not very much aware of the thing which you are going to present, but still be very confident. Fluency, this is another factor. This means speaking smoothly and at the right speed. You should not speak too fast or too slow, and you should not pause too much or hesitate when you speak. Appropriateness of language, this criterion considers how you use the right words and tone for the situation and the patient. Some of the time, there are scenarios in which patient is very stubborn and they are asking you for a medical certificate and they are not actually agreeing with the plan you are devising for them. So in that scenarios, they actually test you that what is your response, how appropriate language you are using. And to be very honest, I used to take the speaking mocks of the aspirants, and what they do, they become aggressive. They become harsh with the patient. That, okay, this is my plan. If you're not going to follow it, then you would be put in trouble. So this is not a way to talk to your patient. Okay, so the thing is, you have to be very, very appropriate in your language. You have to be very soft spoken with your patient. Basically, you are being tested for this, that how you can convince your patient with your plan. If your patient is asking for medical certificate, and he or she is not sick at the moment, then you have to convince that patient that no, it is not good. You have to go to your workplace. You have to attend your school. It depends, like whoever the patient is, but you have to be very soft spoken and you have to create empathy between the patient and yourself. In this way, only in this way, you can get grade B. So resource of grammar and expression, this means using wide range of vocabulary and grammar correctly. You should be able to express your ideas clearly and without confusion. Then clinical communication criteria total 3 marks for each factor: relationship building, understanding and incorporating patient's perspective, providing structure, information gathering, and information giving. So what does these mean? Relationship building. This means starting the conversation in a friendly and respectful way. The thing is, most of the aspirants do what? They used to cram the sentences. Okay, so this is the sentence. I used to cram these lines and then I would say in the exam, I am the doctor here, I'm one of the treating doctor here. I would like to welcome you in my clinic. So what brought you here today? Please don't cram the lines. You have to, you should be able to practice yourself in front of the mirror first. If you are hesitant and shy enough, I would say practice yourself in front of the mirror first, and then try to practice among yourself, with the friends, with the family, with whomever you are living. So it will help you in putting on your confidence. So You have to start. This means starting the conversation in a friendly and respectful way, listening carefully to the patient, not judging the patient, and showing understanding for their feeling and situation. So what does it mean? It means whenever you are greeting your patient, let them talk. Let them say. You have to ask patient first, what are the symptoms, why they are here. Once the patient are telling you about the symptom, please don't go in a rush. Aspirants do what? Whenever a patient is telling them their symptoms, they are just in a hurry to complete all the bullet points of the role play. So they used to interrupt patient at points, and they are just in a hurry of completing their points. So that's what they do. It is totally prohibited. The thing is, even though you are not fully completing your bullet points, still you can get grade B if you are showing a lot of empathy towards your patient. Understanding and incorporating the patient's perspective. This involves asking about and understanding patient thoughts, worries, and expectations. You should also respond to the patient's hints or changes in behavior. If patient is uncomfortable with you, if patient is something hiding, you have to talk to the patient. You have to take your patient in a confidence, and you have to let them know that you are the doctor and you can make anything for them. Providing structure. This means organizing the conversation in a logical way, clearly indicating when you change the topic, and using techniques to make your explanation clear and organized. Then information gathering. What does it mean? This is very, very important point in OET speaking. You have to gather information from your patient, like what's her or his thought, what's her perspective, why she is here in the clinic today. You have to listen them very, very carefully, whatever their story is, asking open question at first, and then more specific question, not asking confusing or leading questions, asking for more details when needed, and summarizing the information to check for understanding. Some of the time, patients are very much shy or hesitant. They are not going to tell you about the complete story of what's happening with them. You are a doctor. You have to figure it out, like what is the actual worry, why he or she is here in the clinic today. And then the last point is information giving. After all the stuff you have gathered from the patient, now you are the one who is going to answer all the things for all the questions. This involves finding out what the patient already knows. You have to ask the patient, okay, Mr. John, I know that you might be having this, and you know that this is worrisome or whatever the thing is. Pausing when giving information to check for understanding, encouraging the patient to share their reactions or feelings, checking if the patient has understood the information, and finding out what more information the patient needs. Think about, always ask your patient that, are you getting me? Am I understandable to you? Do you have any more questions? Something like this, so that it will give an impression that you are making yourself clear to your patient. Think about giving a patient their test results. You would first find out what they already know, then explain results, pausing to check for understanding and to answer any questions. So this was all about OET scoring criteria. I have explained for every module that how it is scored and how you can get maximum marks in each of the module. So there is another view for the booking of exam and when to book exam, with increasing ratio of healthcare professionals applying for foreign jobs and study. Ideal situation is to get your exam booked 2 to 3 months earlier before sitting in it, because saturation these days is awful. And sometimes you may face difficulty to secure your desired city center and venue. So we know that because of the competition, because of the saturation, it is very much difficult now to get slot for OET in your desired city or desired venue. So I would say if you are planning to take the exam, just book it 2 to 3 months earlier than whenever you are sitting to plan to sitting in it. So for the exam cost, we know that it is 587 Australian dollars, and exam is conducted 24 times a year, which means twice a month. So paper-based exam is conducted twice a month, and computer-based exam is conducted 11 times a month. So it's totally up to you, whatever type you want to take, if paper-based or computer-based, because aspirant himself or herself knows better what type suits him or her best. So because a lot of aspirants do ask like what should suit them, so my answer is it is candidate himself or herself who can better decide. Because if somebody asks me, I would say, because I have taken all my exams from my childhood on the paper, so definitely I would say I will be the person with the paper based. So it's totally up to you. If you are good in typing, if you are good in computer stuff, go for computer one. So the other next important thing for today's webinar is we are going to start our next OET regular course from 11th of December. And our course duration is complete 1 month. You will be having 16 live sessions because we are having 4 live sessions for each of the module. So we will complete our course in 1 month duration, and not only the live session, you will be providing with the recording of these live sessions, and you would be having a chance to solve out your queries in front of the mentor. So being a writing mentor, I would say for the writing mentor, I can tell you about writing stuff easily, because for listening, reading, and speaking, we have different mentors for each of the modules. So for the writing module, the format is we have to send the letter in the group, and then on the day of the session, first we cover the session, and then we will go for the live assessment of the letters which are being submitted in the group. So this is the very healthy activity for everyone out there. So there are some of the assessment packages which we have made for our lovely students. So Plan A, Plan B, and Plan C. If you think that you are knowing about OET, you are prepared about OET, but still every student is different one. So the thing is, for Plan A, you can take 10 letters, 10 reading mocks, 10 listening mocks, 5 speaking mocks, and free recorded lectures of all the 4 modules. This is Plan A for those students who are not well prepared for the exam. Then there comes Plan B for those who are 50% prepared. 5 letter, 5 reading mocks, 5 listening mocks, 2 speaking role plays, and free recorded lectures for all the 4 modules. And then there comes Plan C for those who have done their preparation, but they are in a search for taking just for the mock exam, just for their evaluation and assessment, that just to check on which level they are standing. So 3 letters, 3 reading mocks, 3 listening mocks, and 1 speaking mock, and free recorded lectures for all the 4 modules. So these are our packages. If you are interested in any of the package, you can let the team coordinator know. So OET mock exam, just to evaluate yourself, we will be conducting mock exam for all the 4 modules. For the listening, 40 minutes, reading 60 minutes, writing 45 minutes, and speaking 20 minutes. So the thing is, it will be following exactly the similar pattern for the real exam. You have to solve tests for listening and reading on our website. And for the writing and the speaking, you will be given the task for the writing, and you will be given a detailed feedback on it. And for the speaking, we have to conduct it on the Zoom. You will be playing the part of your profession, and the mentor will be playing the part of interlocutor, just to provide you your score and your grade after the mock session is over. So if you have any questions regarding today's webinar, if there is any ambiguity, any concern, any query, you can ask so that we may end our webinar. And thank you so much for being there.
Ma'am, how is OET difficulty level as compared to IELTS? And for medical student, which test is best to choose?
Okay, so I'm not going to say it that OET is much easier than IELTS exam, and I'm not going to say this that IELTS is much easier than. The thing is, for whichever exam you effort hard, it is easy for you to pass the exam. Okay, so whatever exam you are going to take, you have to put your efforts. So no exam is easy without hard work and effort. The other point is, if you're asking for the medical student, my answer would be OET, because in OET exam, there are some of the passages, there are some of the blogs, some of the dialogues and monologues which are related to our field, like the medical terminologies. So I would say for the medical student, it is better to take OET exam.
Okay, thank you.
You are welcome. So there are some of the queries in the comment box actually. Okay, so
Ma'am,
we
is
can.
there any free assessment of the letters before we can take your course?
Sorry, please say again.
Ma'am, is there any free assessment of any letters before we take your paid course?
Yes, for that reason, you can ask the coordinator. I think there would be a number for the coordinator in the comment box.
Okay, ma'am.
Yes, there is. So if you can talk on this number, they will provide you with the information. Okay, so there are some of the queries in the comment box. How can I retrieve this lesson? Okay, so it has been answered. How to get good preparation of reading part A? Time is the issue. This is the thing I was telling you. For the reading part A, it is not that difficult. It is just a matter of time management. And I told you, if you really want to achieve 20 out of 20 in part A, I would say please, please, please practice at least 20 to 25 tests for part A. It is just a matter of time management, and without practice, nobody can achieve all the questions correct in that time limit. We know that it is hard, but still it is doable. Any other question? Any other query? Ma'am, it is really difficult to complete 20 questions in 15 minutes. That's what I'm saying, Dr. Kumar. I know that it is difficult, but it is doable. If you are going to practice at least 20 to 25 tests, I'm very sure you can get it. I myself did the same thing. Help us with past papers for rehearsal. So yes, why not? If you are a part of med exam team, definitely you are in a good hand, and you would be able to having access for all the content and stuff for practice and rehearsal. Don't worry. But ma'am, reading part B is also difficult like part C. No, I'm not agreeing with you in this thing, because I know that part B is not that difficult. I do admit that part C is difficult, but still part B is not that much difficult. I told you the trick. If you can find the keyword, you would be able to find the answer. If for this reason, again, if you're not a part of a course student, then definitely you can say this thing. But if you are part of our course, then you won't be saying this thing, because there is a live practice with a mentor in our course. Please let us know the charges. I think Rehan from our team has shared the WhatsApp details. If you can text on this number, they will help you in charges and the fee structure. Okay, I think so. There are no more queries. Or if you all can please write reviews for today's webinar and whatever the suggestion is in our free group. Rehan, please, if you can share the link for a free group, because there are our free group, and we used to conduct activities daily from Monday to Friday. These activities are totally free of charges. You would be having letter assessment, you would be having quiz, you would be having listening and reading exercises there in the group, and there is a mentor who used to provide you with the answers of the activities. So it is very, very beneficial if you are part of our free group. And please do not forget to write your reviews for today's webinar. And please do join our group for yourself, for ourselves. So I would say that would be very, very beneficial for all of you. So yes, the group link is here in the comment box if anybody is wish to join the group. So here is the link. Okay, I think there are no more queries left. Thank you so much. Thank you everyone for being a participant there. I wish you luck, and I would say please work hard if you really want to reach your desired destination. So if you would be part of our course, then definitely I will meet you there. Thank you so much.